Dementias are different types of illnesses affecting the brain, and they may have multiple causes. But usually, when you have ruled out all potential treatable causes of dementia, what you have left is Alzheimer's disease. Alzheimer's disease is a type of dementia. Dementia is a progressive brain disease with degeneration, and usually they're fatal. There are several types of causes for dementia. For example, vitamin deficiencies could cause dementia. Thyroid problems could cause dementia. Vascular problems and heart problems and circulatory problems could cause dementia. Stroke inside the brain could cause dementia. And hematoma inside the brain could cause dementia. Head trauma could cause dementia. So these dementias are different in their scope and their symptoms and how they present. Alzheimer's is a type of dementia after you have ruled out all potential treatable causes of dementia. About 70 to 75% of all dementias are Alzheimer's dementias. It's a progressive, degenerative brain disease, and so far no one cause was found to cause this problem. The early symptoms are memory problems, keeping the keys somewhere and forgetting where they kept it, and not being able to trace back the events that led to keeping the keys somewhere. We may also forget where we kept the keys, but we'll usually trace back the events and try to find it, and usually find it. Forgetting names and not being able to recall that. Not being able to learn new things, and as it progresses more, not being able to remember things that have happened some days ago, a few weeks ago, a few months ago. And also gradually they tend to develop the symptom of becoming confused, and their thinking pattern gets really abnormal. As things progress, their body remains the same, but inside the brain function deteriorates. It's like a shell. It's one of the most painful things to see a loved one have Alzheimer's, because you see them just like your dad and mom, or uncle and aunt, or grandparents, but they're not really there as far as their awareness and their thinking and their recognition and their interaction. It usually starts after the age of 65, even though some of the Alzheimer's may start before 65. It is 3 times as common in women as opposed to men. It is slightly more common in black women than white women. And it seems to also be a little bit more common in people that have had vascular problems, heart disease, diabetes, thyroid problems. And if they've had some medical problems, they may be more prone for Alzheimer's. 1 out of 8 Americans above the age of 65 have Alzheimer's. 1 out of 5 Americans above the age of 75, before 85, they have Alzheimer's. Once you reach 85 and above, your chance of having Alzheimer's goes to 1 in 2. Right now, there's no one specific test that'll confirm 100% Alzheimer's. The usual thing that absolutely 100% confirmatory test is in the autopsy. You find all these brain findings. And there are several tests now evolving. For example, the genetic test is evolving that will identify that abnormal gene pattern. That is not completely diagnostic, but that will at least give the chance of finding how vulnerable one could be. So before they go through the test, they need to have genetic counseling. Similarly, they have a thorough examination of their blood, of their brain through CT scans and MRI scans. Certain patterns emerge in Alzheimer's disease that can be detected in the brain scans. And they also have tests of their memory, of their thinking. Neuropsychological testing is done to find out how their brain functions are going on to detect Alzheimer's. There is no cure for Alzheimer's yet, but there are some things in life that we could do that may decrease our chance of developing Alzheimer's, which is taking good care of your blood pressure, taking good care of your cholesterol and lipid levels, fresh fruits and vegetable intake, exercise on a regular basis, 3 to 4 to 5 times a week, also the brain being actively involved, learning new things in life as we age. These are all very important. Keeping hobbies, doing those crossword puzzles, playing games like chess and bridge. All these are helpful factors that may decrease the chance of developing Alzheimer's.